Nigeria to take this opportunity to really transform and develop its healthcare infrastructure. With me to lead this conversation is Mrs. Clare Omatseye, a pharmacist and CEO, JNC International Limited. Good morning, ma.
Good morning, WebTV.
Yes, nice to have you on the show. And still with me in the studio is Mr. Bosun Omofaye, CEO, Frontier Africa Reports.
Thanks for having me on the show once again.
I know you would like to hear what's happening in the healthcare space, particularly infrastructure in this period.
It's very interesting. Yeah. We spent many years pushing those guys in the healthcare industry to the back burner. Now they're saving our lives.
Yes,
it's time we speak about them.
We appreciate all the healthcare workers, including the likes of Mrs. Clare Omatseye and all what they're doing for the country. And so, ma, we begin with the assessment of government's response to healthcare, particularly this pandemic period, in terms of the healthcare infrastructure, both at the federal and the state level. We've seen efforts around emergency operations centers across the states, and also government looking at supporting agencies like the National Center for Disease Control and the Federal Ministry of Health to provide those necessary infrastructure and support to patients and all those that need to be taken care of to mitigate the pandemic at this point. What's your assessment so far of this response as a healthcare stakeholder?
Okay, thank you. As you know, I don't think anybody saw the horrible effect that the COVID pandemic has had on all of our lives. We saw it unfolding as early as December from China, and I don't think we thought that it would ever come to us in such a terrible way. So I think on the whole, on a personal level, it's brought a lot of uncertainties, a lot of volatility, a lot of fear to individuals, to companies, and to government alike. And therefore, I think there's a lot that we could have done with the fact that we knew things were coming earlier, but could have done a little bit better. On the whole, I would say that the Nigerian government had a head start because we had the experience of Ebola a few years ago. And we had already set up systems like the emergency responsive system. We had the NCDC, which didn't exist until the National Health Act came into there, and so on and so forth. So government had some head start on what needed to happen for emergency preparedness. But I think that a lot more could have been done with the fact that we saw how terrible it was affecting lives in Europe, in the US, and the number of deaths. If I should start first with state governments, I'll first start with Lagos State. I think Lagos State should be highly commended. Very early on, they engaged the private sector. You know, in addition to being the MD of JNC, I'm also the president of the Healthcare Federation of Nigeria. And we were invited alongside developmental partners and other members of the private sector, engage with the Honorable Commissioner of Health, Professor Bayemi, and he explained exactly what their plan of action would be should this pandemic come to our shores, and then engage private sector very early. And I think this has been something that has differentiated Lagos State from other states. They had an early engagement with private sector. They agreed they couldn't do this alone, and that it was that close public-private partnership that was required to be able to intervene and change the narrative. So as we speak right now, we have set up, I think, 2 isolation centers in Lagos State. One is the GT Bank African Capital Alliance one that was set up in Lagos. And in addition to that, we have another one that was opened just 2-3 days ago. The Young Presidents Organization, YPO, where another 70-bed isolation center was set up with a 10-bed intensive care unit. Now, you know, it's not just about equipment, it's not just about the center, it's about an entire system. So Lagos State has worked alongside private sector, not only to determine the type of infrastructure, to make sure infection control was taken into cognizance, and to make sure the right equipment was there, but to make sure that the people were properly trained. They've gone beyond the scenes. They've been trained in Yaba on everything from infection control, donning and doffing of personal protective equipment, and so on and so forth, to the actual training. We have attracted a lot of volunteers, and there's a volunteer scheme that has an incentive that's also paid by the private sector. And this is really commendable compared to other parts of the country. On a secondary note, they've also tried to increase the amount of testing that's going on. We look at our country today, the number of tests that have been done, it's too low for a period, for a population of about 200 million people. And therefore, we need to up that. And I think Lagos State, in partnership with NCDC, is working hard on that. I'd also like to commend
the larger effort of COVID, the Coalition Against COVID, which is, again, a private sector body partnering with government, looking at what are the critical things that need to be done and having a concerted effort rather than multiple duplications of efforts, having a single effort on what we need to do quickly to speed up, to ramp up the capabilities, not only in Lagos, but of course, every other part of Nigeria. When it comes to the federal government, again, I think I'd like to commend NCDC and the Federal Ministry of Health. First, they've had open communication. They have tried to keep, the grapevine and the false claims that you see sometimes on the internet, and made sure that there's clear communication on the number of tests, the number of people who have had it positive, the number of people who have reverted back to negative, and unfortunately, the number of people we have as a country lost. And that's, may their souls rest in perfect peace. So I think on the whole, government, from an advocacy perspective, has reached out to private sector, and I think private sector has responded in a positive manner. On top of that, we've had organizations like the Nigerian National Petroleum Company that have galvanized their members. So you have the downstream partners who are in the process right now of taking over the whole NNPC hospital and renovating that hospital into not just an isolation center for NNPC staff, but for the indigents of Abuja. And then eventually making it a full hospital. They've also had the indigenous petroleum partners, IPPG, donating 45 ambulances, PPEs, personal protective equipment, very important ventilators. And when I say ventilators, I mean real ventilators, not some of this cheap and cheerful stuff that is in circulation that they're calling ventilators. And this concerted effort that is very well organized and being spearheaded by NNPC Group Managing Director himself is extremely commendable. Then we now go to the central bank. The central bank has given the private sector what, honestly, we've been crying for years. Healthcare was already in a dire straits. It was in a state of disarray before we started. We had infrastructure that was dilapidated. We had healthcare workers that were leaving the shores. So we had two types of drains, a brain drain and in addition to a patient drain. There was almost becoming a lack of confidence in both public and private sectors. Those that could afford it went on medical tourism. We were losing in excess of $1 billion, if I quote Okonjo-Iweala, former Minister of Finance several years ago, as saying, but these are the flows that we saw that went through central bank, and therefore you could measure. The average Nigerian does not tell anybody when they go and see the doctor. So we already had medical tourism and brain drain. In fact, the brain drain in the last 1 year has never been so bad. We were losing at some stage, according to Health Watch, over 6 to 7 doctors a week to the US, to the UK after Brexit. And this is a big challenge because we need people. It is people, skill sets, healthcare workers, not doctors, nurses, pharmacists, physiotherapists, lab technicians that make an entire system. And this was a big challenge for us. We also had the bigger challenge of access to capital. Most people couldn't afford to pay for the kind of loans that we needed to change the infrastructure narrative. You needed in excess of billions of dollars to be able to build the healthcare system up. And we in healthcare were borrowing at about 20%, 20 to 26%, depending on who you are. Remember that the average healthcare business is an MSME, and therefore all the challenges with the SMEs face us. So we've been asking for interventional funds. We've been asking to reduce the barrier to entry, to make access to quality healthcare more affordable by providing quality equipment with no duty, with reduced tariffs, with pioneer status. And although we had been making progress, we hadn't had the listening ear of government like we do now. So I don't think we need to preach the gospel that health is wealth. Everybody knows it is. So the central bank has rolled out some really important, I would call them fiscal policies that will make a difference. First to households, because remember the average Nigerian pays out of pocket for healthcare. And every time they pay out of pocket, they become impoverished. And then if you think about non-communicable diseases like cancers and cardiovascular, this is really a big challenge because people can't afford healthcare. So now with this intervention, I think the CBN has been able to give a 50 billion naira credit facility for households and MSMEs. This will really help to galvanize and keep people through this very hard period of time. I think it's very benevolent of central bank. I just hope that the money does actually get to the right people and doesn't get truncated on the way. Another very commendable intervention is that the central bank is providing $100 billion interventional fund for healthcare businesses. So now, instead of us importing 70 to 80% of our drugs, we can encourage more local manufacture of medicines and have drug security, which we don't have. Because now the barrier to entry is lowered. There's no duty on importing pharmaceutical equipment, pharmaceutical manufacturing. We can get lower excipients and active ingredients, lower duty. There's no duty at all. Now bringing in ventilators and things, the duty should be exempt. The only challenge, I must say, is that it's still on paper. We need to get that policies of central bank gazetted. Once it's gazetted, then it will really make an impact. So although it has been promised, it is not yet implemented. So whatever we can do, WebTV, to make sure that gets done, it would be great. I think also the fact that they're also providing support to the NCDC, the Nigerian Center for Disease Control, through provision of isolation centers and ICUs is fantastic. And I think finally that we really want to help, and they want to help in speeding up the testing that's going on in Nigeria, because we need to have more test centers. I don't know if most of you know, but most of the tests that give you that surety of whether somebody's COVID-19 positive or not is called a PCR test, polymerase chain reaction. This requires a very high-tech machine and also skill sets to make sure that you can get the right results. It takes a while because you have to extract the virus, amplify it, purify it, before you now go on to doing the PCR itself. Prior to COVID coming into our country, we had very few centers that could actually ramp up to do COVID-19 testing. I think we had just 4, Lagos and Abuja. And this is a challenge because the rest of the country was a bit barren. But I think that intervention of the central bank, intervention of NCDC, and the private sector working in cognizance with each other has helped to change the narrative, and we are now on the right path. In fact, I think the WHO commended Nigeria for our approach towards COVID. And I think, again, as I said in the beginning, that the experience of handling the Ebola virus has helped government to get this done. But we must, to collectively help to increase the amount of testing. Not enough testing is being done. So, I have commended the government, but more needs to be done. We need more people tested. We need more people to have access to basic commodities and food. Because before COVID kills people, there's a hunger virus in addition to the coronavirus that needs to be tackled. And I think though a lot of NGOs are coming in, we need to coordinate the efforts of the feeding of people who truly cannot afford a meal a day. And I think finally is that we need to leverage more on technology. The lockdown that has been instituted first by Lagos State and Abuja was a great start. But I think we should have made the lockdown a compulsory thing nationwide a lot earlier than we are envisaging today. There's still talk about it. It hasn't been officially announced, but I think it's important that we do so that we flatten the curve earlier, understanding that our situation is not like every other developed country. We don't have the infrastructure. We don't have the people to run ICUs, intensive care units. The skill sets cannot be learned in 2 to 3 days. We need to be able to take people who are anesthetists, who are already doctors, and train them how to do ventilation support and lung support and respiratory support and lung recruitment. But it will take a while. So in the absence of having the people and the equipment, we need to flatten the curve and prevent people from even going to that stage of COVID-19. So on the whole, I think government has tried. More partnership is required. I think an olive branch more to private sector again. I think COCAVID is doing a great job. There's a new center again being set up as we speak in Abuja, a 300 beds facility in the Dome. I think the Sahara Group and some other organizations have come together to set that up. Very commendable what is happening, this close public-private partnerships. And we just need to keep that effort going and be our brother's keeper in Nigeria.
Oh, thank you very much, Mrs.
For your response, very, very, very detailed. I know Mr. Moses has been eager to
quite a very comprehensive industry report.
Yeah.
Thank you very much. At least we have folks within the healthcare industry, field of medicine, appreciating what the central bank has flagged off, as it were. I think one point you raised was how Lagos State had always been at the forefront of being ready for emergencies such of this nature. How we're able to replicate the rapid response and the readiness of Lagos State across the other 36 states remain to be seen. and how we can onboard that. I don't know how this will be done at the government level. That how is it possible that Lagos is almost always ready, like in the case of Ebola and in this particular coronavirus issue? How do we get this level of governance response photocopied or rank zeros for other states as well, so that they're also ever ready as Lagos State is ever ready? That is on one point. But again, I'm sure your organization have done quite a lot interfacing with various stakeholders within Nigeria's healthcare sector. So one area that the central bank has touched about has to do with research, R&D. And I'm sure you know that R&D is at the heart of pharmaceuticals and healthcare industries around the world. So, and this comes to fore, I'm sure you know, news all out from UK, from South Africa, from the US, the universities are even leading, are taking the lead, working with the government. How do we get our universities to be as responsive as this when it comes to matters of this nature moving forward? Claire, in terms of what have you learned on the ground that we can use public universities and maybe private universities to also assist in terms of their R&D, research and development, and our research institutes when it relates to the healthcare industry as a whole? Your thoughts, Claire, please.
Okay, thank you. I mean, on your first question about how do we scale up and leverage
On what we have learned from Lagos State, I think first it starts with leadership. Lagos has always had this exemplary way of teamwork. You know, there's a great collaboration between the commissioners, between their choice of commissioners over the year. We had Jide Idris for 12 years. We've had Professor Abayomi now, who's an expert in this area in biosecurity, and their choice is apt. Then you have a leader who is at the forefront, he's driving from the front by example. And I think that's really commendable too. But having said that, the rest of the country does look at Lagos. I mean, you have to look at Lagos as an epicenter for commercial activity. And because of the population we have, which is a little bit more enlightened than other parts of Nigeria. But I think also the collaboration they have with the federal government. They have always engaged with the Federal Ministry of Health and also engaged the NCDC and carried everybody along and talking from a scientific perspective as against just a thought process. I think their blueprints, you know, their methodologies and their processes are such that can be replicated and can be, through the NCDC, can collaboratively disseminate this to the rest of the country. And I know that they're already working on that. I know there are parts of the ministry that are already helping other states to scale up. I mean, the neighboring state to us here, which is Ogun State, benefits from some of that. And you can see, you know, if they don't get it right in Lagos, it will affect their state. So there's a lot of collaborations. I think that's really the way to go, that strategic collaboration and partnerships, open books, sharing of what works and what doesn't work, scaling up fast on the things that are very important, concentrating your efforts on the low-hanging fruits that will make a significant difference. So getting the testing in there, doing your contact tracing very fast, getting the facilities set up in collaboration with the private sector, again, working with the likes of a COCAVID that has been able to raise over 25 billion naira and already donated in excess of 1.6, food to 1.6 million families as we speak across the country. This is the kind of thing that we need to keep going. On your second question about universities, gentlemen, I feel your pain. When you see what goes on in the world, you are right that there's a lot of research and development going on, and that's usually university-led. As a country, research and development hasn't really been our strength. But I think that I hope that we will learn our lesson from this harrowing experience. I mean, I don't want to say we should learn the hard way, but universities can then take the true potentials of what they could do. There was a few weeks ago an invention, very simple invention somebody in the US found, which was a valve that you could do 3D printing of, and it would be able to allow one ventilator to be used for 3 patients. I collaborated with one of the MDs of a bank who was really interested in saying, what could we do to get this? And do you know where there's 3D printing? I did a bit of research. And there's very few universities that A, have the 3D printing capabilities, or B, have the capacity to scale up to what we required. And I saw it as a big gap, but it's also a niche going forward to say 3D printing is the way lots of people do. They do design engineering on computers, computer-aided design. They go on to further it with prototypes, and then they now do 3D printing of the prototype before they go commercial. And I think our universities can go there. But beyond medical devices, I think there's something else that is more important, not just research and development. And that is that we, as long as we're training the graduates, we also need to have a universities or polytechnics training technicians. We have a lot of equipment that is left scattered all over teaching hospitals and private hospitals, that the biggest challenge is that they used it for 3 weeks, 3 months, 3 years, it broke down and there was nobody in country to fix it. Now, if you buy it from JNC International, we have 25 proudly Nigerian engineers who do all the after-sales service, so the maintenance, the applications training and everything else. But that we cannot be everything to everyone in the country. Therefore, we need to really get more people in technical training colleges, technical training courses that will help to close this gap, and that we can sweat each of the assets that we have. We also need to encourage research and development into homegrown solutions. If I take the pharmaceutical industry as an example, the active ingredients that we use in all our drugs, even for what we make, and even the excipients are what you use to bulk up the active ingredients. So paracetamol, you have acetaminophen, but you have to put starch and other things in this to bind it together and make it a tablet, are all imported. But we have a tapioca, we have cassava that we can make into tapioca starch and ethanol. We should be able to encourage this, get it to the right quality for pharmaceutical use, and we can do some backward integration and start doing this. But again, this is just the excipients. Why are we not doing enough research and development into active ingredients? There are people that believe in traditional medicine. I think that traditional medicine actually does work. The only thing is it's not standardized, and therefore it's not replicable from one patient to another. But we could do a lot more research into some of these, destined old drugs that people take, herbs that people take, including things like agbo. I don't know what is inside that root, but whatever it does, people believe it works for them. And we could actually get our own drugs. Nigeria needs to get a drug security status where we are not dependent on too many nations for our basic drug supplies. And I think that the universities are the best place for research and development to get this going, and that this is something that we could do. Finally, we should also be looking for more. High tech does not mean that it's the best quality. We could have a ventilator that almost does the same thing as the high-tech ventilators, but without the excessive technology and electronics. And I know there's a lot of universities internationally that have some open plans. There's no reason why we shouldn't be able to do that in country. I must commend the Nigerian Army. I'm not sure if you're aware, but they've actually developed their own ventilator in-house through their own research and development. And that's what we need to hear. So this unfortunate pandemic should spur on innovation, creativity, out-of-box thinking, more research and development, more money being set aside, more grants by private sector to research institutions. People need to learn how to write grants. And let's have some homegrown solutions that are more affordable, more available, and efficacious to be able to take a difference.
Okay, Mrs. Clare, let's look at the primary healthcare centers, because
the WHO has warned, and even the African Center for Disease Control, the concerns is about community transmission. And yes, we are getting almost close to 1,000 cases now. Primary healthcare centers are very important to help improve and ramp up treatments even at the rural areas. What would you be saying to equipping PHCs across the country? I know the federal government had in their strategy to equip 1,000 across the whole country.
Yeah, very interesting question. Claire?
I think there was a concerted effort of government to get
primary healthcare right. You see, if we don't get primary healthcare right, we can never get access to healthcare, quality healthcare, to the realm that we need to get it. This pandemic has actually exposed the huge deficit that the Nigerian healthcare infrastructure has. And government's recognition of this, I'm sure you know about the National Health Act, where there's a fund that will be given to the primary healthcare centers, which will help. But I think, bearing in mind where we are, the PHC should become the first place of call, really, and not the tertiary hospital for symptoms that are basic, like nausea, vomiting, diarrhea, cough and cold. And unfortunately, this is what exactly today represents COVID. So it's very important that we get back to our roots and focus on primary healthcare. But the challenge is that most of our primary healthcare are just buildings. There's no proper infrastructure. They don't have running water. They don't have, power. They are not properly equipped, and they're definitely not manned. There's also laws that are a bit archaic. You have to have a doctor per primary healthcare center. If we have 10,000 primary healthcare centers, it means that for you to be able to do 24 hours, you need to have at least 3 doctors, because there'll be 3 shifts. That'll be 30,000 doctors. On our register, the register as we speak right now, we have less than 50,000 doctors in the whole country. So it shows that there's a disconnect between some of our laws and what we actually need to connect. So going back, we do need to get the primary healthcare centers up and running. We probably need to designate which is a super PHC that will run 24-hour services, including deliveries. Too many women are dying. We have some of the worst statistics in Nigeria for under 5 mortality and maternal mortality. And that is because over 70% of women do not give birth in a hospital. And they do not give birth with a skilled attendant. Now, if we have primary healthcare centers designated in local governments that will take deliveries, we could change that narrative and reverse this negative trend. There's so many women that die on a daily basis and children unnecessarily because the primary healthcare center doesn't work. So that is the first one. Then we can have another set of centers that may not do deliveries, may not do 24-hour care, but they can do a 12-hour service from 8 to 8, a walk-in service. You do all your general checkups, and you can also do a reach-out service with the community service. Now, here I think that we need to focus a little bit on the use of technology, leverage on technology, and we also need to focus more on prevention than cure. There's too much, I'm sick, and then you go to a hospital. What we should be doing is preventing communities from getting sick. They must be encouraged to do their blood sugar tests, their blood pressure checks for hypertension, and so on and so forth, cholesterol checks. If we do this, we'll be more proactive. They can do their checks at home, use technology, pass it on to the doctor, and the doctor does the reading. And I think more and more today, our primary healthcare center under COVID has been replaced by a phone. I know this sounds a little bit disruptive. The average hospital will refuse any patient that has a fever, that has a diarrhea right now, because they're afraid that it is COVID. And therefore, a lot of people are dying, not of COVID, but they're also dying because they have other underlying diseases. So the phone has now become the new doctor, the new primary healthcare center. And there's a lot of telemedicine going on. So there are free services that are being delivered. There's a lot of apps that you can call a doctor, speak to a doctor. You get your medications. There are other apps where the pharmacy will deliver the medicines to you. And this, you can see COVID has spurred innovation in the provision of primary healthcare, not necessarily just the primary healthcare center. But having said that, we do need to ramp up on getting our PHCs where they should be. We need to probably, again, involve the private sector. I know that Mr. Aig Boje Imokwede, the former MD of Access Bank, has been working on a concept called Adopt a PHC. And this is such that every corporate organization, every individual in Nigeria should be able just to look in their locality, take 3 or 4 primary healthcare centers, know it's going to cost them 10 million naira a year to fix it, and then therefore maybe another 2 million naira running expenses. You adopt this PHC and provide as your own CSR, community effort, in collaboration with government, what is required to keep healthcare where it is. Once we get primary healthcare right as a country, we have a start to access to quality healthcare. So it's very important that we get the diagnosis right, that they get the right kind of equipment, that we train and retrain the healthcare workers there, that we leverage on technology to replace the absence of a doctor for primary healthcare center, because that's not going to happen. We need a lot of doctors in secondary care in the general hospitals. We need more doctors again in tertiary hospitals. So with that huge division, we have to also do what is called task shifting. Task shifting is a consultant gives a doctor some of his responsibility, a doctor gives a midwife some of its responsibility, and so on and so forth. So you take some of the skill sets of a skilled person and give it to somebody else to handle in a structured way, such that somebody who is not a doctor could do basics of medicine. And then you leverage on technology to be able to do the triage and so on and so forth. But we do need to also think about, in these times, providing these primary healthcare centers not only with equipment, but also with personal protective equipment. A lot of our doctors and nurses are getting infected. In fact, as I heard from the news, over 50 people have been infected by COVID because they didn't have the right PPEs. I saw the headlines this morning in the newspapers that no PPEs, healthcare workers should not work. So healthcare workers are not only those in the forefront of working at the COVID centers or the isolation centers, but everybody in the whole value chain of healthcare that is COVID facing. So the primary health centers, the secondary centers, everybody should be assumed to be COVID positive and then treated properly. But then people shouldn't be turned back. I had a very harrowing experience a few days ago. The primary healthcare centers are not working. Somebody is having some chest challenges. He's breathing a little bit heavily, probably having an allergic reaction or an asthmatic attack, goes to 2 or 3 hospitals. They don't accept him because they're afraid it's COVID. Says you can only go to Yaba. They're told in Yaba you need to have an appointment. They now go to another teaching hospital in Lagos. That A&E refuses him to go in. Now, luckily, he has already done a COVID test and therefore is fine and is negative and gets care. But what happens to the person who doesn't have access or who hasn't done a COVID test? What actually then happens? These people, unfortunately, are passing away. A lot of people are passing away because they're not getting access to care. So we really need to get primary care services sorted out alongside the COVID services. It's very, very important, and we must work together to get this going.
Okay, Mrs. Clare, you've just mentioned something. I want to bring it up.
As the president of the Healthcare Federation, we have these developments about some hospitals, reports from the Lagos State of several hospitals that had patients exposed that were COVID-19 positive. And so because of that exposure, some of them have closed their operations temporarily. And this has created a lot of concerns in the state. People who even have their HMOs put in the hospital are concerned how will they get service because of this period. So I'd like you to just speak to these concerns. If the HCF is engaging in this regard, because you just mentioned something, I mean, a lot of people could have emergencies and all that and could just lose their lives because of this poor management and process. And then you can also speak to the capital market coming in here. We heard about the Capital Market Committee planning a 1 billion strategy to support the COVID-19 mitigation. And also, Mr. Boson has been talking about a pandemic bond. A pandemic bond. I mean, do something that will be large scale, support the health care so that in the future, if such thing happens, we have a fund to build from. Yes, those two. And I think later, Boson, you have 1 or 2 things to say.
Sorry, I didn't hear what you said, the last sentence?
The last sentence is talking about a pandemic bond, a bond in the market that can bring in everybody. You're talking about coordinated efforts. So, the market has a way of coordinating efforts. Yes, yes. So what do you say to such ideas? Just those 2 questions.
On the private hospitals, I think
it's an unfortunate situation that many of them had to close. I don't want to say it's a lack of preparedness, but I think it's just the reality of the time that COVID has taken a lot of us by surprise. And we didn't envisage the enormity of the challenge to the world and of course to Nigeria. So what most organizations have done is put in some kind of protocol for the treatment, first for their staff, and then for the treatment of guests coming into their facilities or patients into the facilities. So as a company, for example, we have very early on, way before the lockdown, made sure we had a plan for remote working. We also made sure that anybody that was in the front line that had to come to the office had adequate access to PPEs, that there were lunches that were provided to them in the office so they didn't need to go out, that they kept the social distancing, and so on and so forth. Now that we could do because we're a company and although we're extremely busy at this point in time, there's a huge amount of need for setting up isolation centers and ICUs, which we've had the privilege of working with many partners to do. But on a daily basis, people are calling you for PPEs and we have to set up. So there's going to be a lot of interaction with us and hospitals. Now, on the other hand, these hospitals, they take deliveries and they also receive patients. So that the first patient to get care right now is a pregnant woman. They will not refuse a pregnant woman because they can see it's definitely not COVID, that she's having a baby, and therefore they are still getting care. I haven't heard of any case where a pregnant woman has been asked to go back, but there have been a lot of concerns because there hasn't been adequate testing, either for temperature check or following the proper protocol of hand sanitization and so on. But remember, this is a peculiar disease. It is actually contagious, even in an asymptomatic phase. And that is a big challenge. Because even if you do the temperature check and you do the hand washing and so on and so forth, somebody without wearing a mask, because it wasn't compulsory prior to today, could also cough in the environment, could have had, because of contact, the virus on their hands and touch somebody else. And I think it actually led to community infection. And that scare of community infection with a few people getting infected in the hospital environment has led to what has happened with the closure of several hospitals. It's important that they closed to get the protocols right, to understand and be taught and go through all the training that Lagos State and CDC provides to hospitals that need to stay open. In addition, to make sure you have the right PPEs for your staff, that you do the right testing of them, make sure people over this 14-day period, you can make sure that people are not really exposed and you can find out who's who. And then finally, to actually disinfect the hospital so that anybody who else is coming after this knows that they're not going to catch COVID from that hospital. And then set up cleaning protocols that reassure both staff and patients that it is free of COVID. And so I think that is what has led to the challenge we are facing right now with the closure of some of the hospitals. The HMOs are facing a challenge because, you know, some of them allow you to port, which means you can go to another hospital. But for those that you only have a hospital as your primary provider, it has become a bit of a challenge. But I think that they are trying to find innovative solutions. I mean, I must say that the amount of innovation and out-of-box thinking that COVID has brought, including things like this webinar where there's a lot of training and a lot of meetings online, has been highly commendable. And I think the hospitals need to also leverage on technology. So the last point I'd make is that most of these hospitals now, although some of them may be closed or some of them are not closed, what they're encouraging is more teleconsulting or tele-radiology, working with partners like Helium Health and so on and so forth that can provide this access to care without you physically being there. You still see your doctor, you have a video call, you get your prescription done, and only when you need to come into the hospital, you can be triaged, and then you now come into the hospital environment. And so I think it's a learning experience. We're on the learning curve right now, but the other hospitals that didn't have this challenge are learning from the experience of others. And the big hospitals are bearing the brunt of revenue loss and not providing, you know, inpatient care for a few weeks until this is all resolved. On the issue of exploring capital market innovations for pandemic bonds for healthcare, I think it's actually a great idea, and it would really support the government in paying for emergency responses in situations like this pandemic, and should it happen again with a different type of pandemic. Remember, prior to COVID, we had Lassa fever, which I guess didn't affect everybody and therefore didn't have the same impact on the economy like that has led to lockdowns with COVID. So I think this would be really important to have funds like this that should be directly collated or directed at solving challenges associated with medical emergencies, general disasters, natural disasters, pandemics, providing equipment, providing services, paying for healthcare workers and ancillary workers. Remember, there's ancillary workers too. You need people that help to clean. You need people that help to take away biological waste. You need to increase the amount of biological waste sterilization and recycling that goes on. So healthcare is not just a hospital, it's an entire system. And a bond like this would go a long way to provide funding, bearing in mind that the oil price has dropped, that the revenues being generated as a country right now are very paltry. Important that we can engage government to see ways in which this due diligence could be done. I know that the World Bank in 2017 created something similar, an emergency financing facility, and I'm sure this surge of funding to developing countries can also be something that we could leverage on too, that we could become a beneficiary to. So post-COVID, we need to learn from this experience and make sure that we're more prepared in the future to be able to raise the necessary money for businesses, for the issues of the day, and for longevity thereafter.
Okay, Mrs. Clare.
Your closing thoughts, we'd like to get your closing thoughts. You just mentioned it post-COVID and the outlook for Nigeria's healthcare. You're proposing a national lockdown, and you know that if that is done, it has its own implications. But what are you looking ahead for the Nigerian healthcare sector? What do you like to see happen more? I know you've talked about infrastructure, coordination, research, and the need for more support in that regard.
The first on my mind is I think that this has been an eye-opener for everyone, individuals, families, businesses, state governments, world powers alike, and that it shows that health is wealth and health is one of the critical drivers of the economy. And therefore, I would like to see that beyond COVID, that health is taken as a priority sector. And as a priority sector, that means everything that is required, from having the dedicated funding for it to prioritizing funding. You know that there's a promulgation that was made in Abuja many years ago that 15% of budgets should actually be spent on healthcare to be able to spur economic activity and everything else in the country to make a difference. Right now, I think we're less than 5%, we're about 4%. Pre-COVID, we're at 4% as our budgetary allocation to healthcare. So we'd really like to see a better allocation to healthcare and a better application of those healthcare funds. I'd like to see innovation being developed, more public-private partnership between the private sector and the public sector. There's a lot that can be done collectively. 60% of healthcare in Nigeria is provided by the private sector. And that close collaboration is what is disruptive, that can bring the disruption that is required to make a difference. Be it setting up hospitals, setting up pharmaceutical industry, setting up syringe factories, glove factories. We have to be able to be self-sufficient. I'd like to see a clear policy, incentive policy that lowers the barrier of entry for businesses interested in investing in healthcare, both physical and non-physical policies, such that this, for example, duty waiver is not just till December 31st, 2020. That is beyond that for maybe a period of 4 to 5 years. Let this be a window where investors in healthcare, remember now, it will not just be healthcare people investing in healthcare. Now that we are all aware, our ignorance has been removed. We are now aware that health is wealth. And if we don't have health, all the money in your briefcase won't help you. For the first time, you can have $1 billion in your briefcase. And if you don't have the healthcare facility in close proximity to you, it's of no use to you. So we have, even if it is just for vested interest, we need to collectively fix healthcare. So when I say physical and non-physical, there should be we should have special allocations to healthcare businesses of a particular investment where government provides the land as their own contribution. We should also have tax breaks for the first, say, 5 to 7 years of business, so that you can, again, lower the barrier of entry, make it more affordable for patients to get it, and then people can then access the higher technologies. We also need to, this would help to spur medical, the reversal of medical tourism. There'll be more confidence in the Nigerian healthcare system, both public and private sector, when you have the right infrastructure, when you have the right equipment and the right people here. The likelihood that any of us goes abroad and sees a Nigerian doctor is about 50% when you see a doctor abroad. So if we can get our diasporans back in country, the only reason they'll come back is if they have the same infrastructure that they're and tools and equipment. And if they're working with a 160 slice CT scan in the US, in the UK, that's exactly what they want to work with here. They don't want to work with the 32. They don't want to work with the 64. That's what they want to work with. So we need to be able to provide the right technology, but this technology is expensive. Another area that gives me a big concern is that we have a triple-edged sword. Now it's quadruple. We have the communicable diseases. We need to spend more money on vaccines. We also have issues to do with communicable diseases like cardiovascular diseases, like cancers, like diabetes, that so many people have to pay out of pocket. But I don't even call it out of pocket right now. I call it catastrophic out of pocket. So we also need to have insurance for a basic package, but also insurance for chronic care, such that if I get access to the NHIS, it makes it mandatory for everybody in Nigeria to have, are you there? To have access to care, then that's what happens. And I think that the final point, sorry, are you still there?
Yeah, I can hear you. Go on.
The final point really is around, again, looking for ways and incentives in which we can provide I don't want to call it the poor, but the underserved communities, the less privileged, give them access to a healthcare insurance package that includes them, so we have to do some kind of index that really shows you don't have a BVN, you can't afford a cup of rice a day, you can hardly eat a meal, and then they get automatically access to some kind of health insurance that allows them access to primary healthcare. These are some of the things that I think could really make a difference. I think that also there will be, healthcare is not on its own. You have to get the educational sector where it is. We need more doctors, more nurses, quality and quantity produced. We need to have better food. If you don't have the right kind of food, no matter what kind of equipment you have, people, if they don't eat properly, malnourishment is one of the reasons why we have a lot of under 5 mortality and why we have stunted growth. And that also affects people's brains and things like that. So it's important that we get that sector. I think it's going to be a multi-pronged approach of education, healthcare, and agriculture being on the top burner of Nigeria, especially beyond oil. With oil at $20 a barrel or less, it means we have no choice now but to think of life beyond oil. And we need to prevent and plan ahead of a pandemic coming again. Nigerians need to learn to be germophobic. So it's not hand washing for COVID. It should be part of our way of life. We should be washing our hands as often as possible. We should make sure that personal hygiene is taught in schools, that, this is top of the agenda. We need to finally check what comes in and out of Nigeria. We need to have a different set of standards. Nigeria has become an equipment dumping ground for the good, the bad, and the ugly. I have seen all sorts in this last 4 weeks. Some of the things that I said I will write a book on because I've been so disappointed and personally appalled at some of the things that people do. A ventilator, for example, is a machine that is used to support life. It is a life-saving equipment for the critically ill, where there's organ failure, your lungs are not functioning properly. It is not a toy to be played with. It is not something that every Jack and Jill should sell. Selling it and using it are two different things. The use of it can cause more damage if it's not controlled by the right type of doctor. You can have barotrauma where you put too much air into people's lungs and you cause more damage than you started with. But there's a lot of toys being peddled as equipment. So we need to have standards. What is a ventilator? What should the PEEP be? What are the filters that are required? What is the expiration that is required? Different standards that we must comply with before you bring it in. But right now, people are bringing in all kinds of things. There's no SON, there's no NAFDAC approvals. There's a lot, I call it like counterfeit, as just like we have counterfeit drugs and adulterated drugs, we have the same with the medical equipment. So it's important that we have a very clear mandate to have certain standards, minimum standards, if necessary, only select manufacturers for everybody to bring in the short term till we can get it right. So these are things that we must start to concentrate on. And I think that COVID will be that platform to provide a change in the narrative for healthcare going forward. And I think that it's not going to be the same. Life will not be the same after COVID. Technology will play a major role in our lives, as you can see now, even in this interview.
Thank you very much, Mrs. Clare. You want to give your closing thoughts?
My closing thoughts, thank you so much, Claire. I think to add to what you said, something very important, you put the healthcare, it's not just about hospitals. So my final thoughts on this is that we also need to get our fiscal authorities to understand the need to include environmental planning into this, because if we're going to situate medical or primary healthcare facilities on a very dirty street, a street that is on street corners or in communities that are very dirty, not cleansed, and folks are passing faces around.
Yeah.
So I think one of the things we need to also include is that health is wealth, and since healthcare goes beyond the hospitals, if we're going to practice washing our hands and what have you, our environment is also important. So in terms of urban planning and the civil society, I think this is the time for the authorities to also know that we need to have drainages, we need to have streets that are roads that are well kept, and communities that are clean, cleanliness is said to be next to godliness. So if we're going to have all the beautiful ideas and things we want to invest in, we will not be investing in bringing equipment and building facilities in very dirty, very nasty neighborhoods. I'm not too sure that should be good for us. So I think the government should see this, that look, we need to have environments that are clean, that are well planned in terms of access to pipe-borne water, which is basic, access to motorable roads and what have you, so that everyone stay healthy before you would talk about even going to the hospital.
Yeah.
I think that is the underlying sense in what I picked from what Claire says about healthcare is not just about hospitals. So thank you for bringing that phrase in.
Thank you very much,
Thank you very much,
Clare
Omatseye, for your very insightful contributions. We all know health is wealth, but we have to understand how important healthcare is, and it must come to the front burner
of our national policy and economic strategy so that we can really have a sustainable nation and society. Thank you very much, Mrs. Clare Omatseye, pharmacist, President, Healthcare Federation, and CEO of JNC International Limited. Thank you for being on our show today.
Thank you for having me.
Yes. It's been interesting having you, Mr. Bolson.
Thank you so
the
much.
week. I mean, interesting.
Thank
Economy
you.
and Politics and
Interesting.
Market,
Thank
CEO Front Africa Reports.
Thank you, Otto.
Yeah. And that'll be all for the market review today. And it has been interesting discussing how COVID-19 pandemic impacts our healthcare and the need to develop a robust infrastructure for this critical sector. We'll continue this conversation next week. And we'd like you to join our website, www.proshareng.com, to get more market reports and analysis and stories around this period. Also, we have a platform where we give you all the details you need, the Corona Central Watch. There, you can get data analysis on how COVID-19 is impacting the global and Nigerian economy. All you need to do is to log on to proshareng.com/COVID-19, and you get all those analysis and details. Till we come your way again, thank you for watching. Have a nice day and stay safe.